Some of y'all may know me, some of you may not. I'm Derek. I'm a oriented BSN student at the W. I'm here with several of my classmates, Jenny Flake, Whitney Franklin, Heather McGraw, and we're going to talk to you today about coronary artery disease. We've got some objectives we hope you can meet when we get done with this. When we get done, we want you to be able to give a brief description of coronary artery disease and tell how far coronary artery disease can be dated back with 85% accuracy. List 5 risk factors associated with coronary artery disease with 90% accuracy. Describe the common signs and symptoms found in patients with coronary artery disease with 85% accuracy. We also want to you to be able to discuss how coronary artery disease can be diagnosed with 85% accuracy. We want you to be able to discuss treatments of coronary artery disease with 85% accuracy. Write a comprehensive care plan for a coronary artery disease patient with 90% accuracy. Troy, you think you can handle all that?
We need those terms in also. we need the right care plan.
So we're going to start at the top. What is coronary artery disease? It's a disease which waxy substance called plaque builds up inside the coronary arteries. It's usually called arteriosclerosis. It may take years to develop. Symptoms occur with narrowing and occlusion of the artery. Some origins of coronary artery disease. The Egyptians had 2009 researchers presented a study that results done in mummies 3,500 years old, and they had evidence of coronary artery disease. Leonardo da Vinci investigated coronary arteries. Friedrich Hoffmann, chief professor of cardiology at the University of Halle, noted that coronary heart disease started in the reduced passage of the blood within the coronary arteries, and that was in the 1700s. Coronary artery disease is the most common type of heart disease. Leading cause of death in the United States in both men and women. About 610,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. Some common risk factors: age, gender, family history, high blood pressure, high cholesterol, smoking.
And I'm Jeannie Flake. I'm going to pick up at risk factors. So core diet, dyslipidemia, overweight or obesity, inactive or sedentary lifestyle, and other health problems such as diabetes can contribute to your factors. This just kind of shows the traditional factors on this side: hypertension, smoking, diabetes, menopause for women. And on the other side, it just shows some non-traditional, which would be like chronic inflammation and things like that, metabolic syndrome, renal disease. All of these can contribute to your factors. Men and women, it's the #1 killer of both men and women. So the men usually manifest about 10 to 15 years earlier. Their initial cardiac event is a massive MI. Higher incidences of the left ventricular hypertrophy. The women, it causes more deaths. Do you guys know why? Women usually have different symptoms than men. They have shoulder pain, they have neck pain, they have some refer to arm pain, but they think it's stress or something like that. Whereas men will have chest pain and they'll come. Their initial cardiac event is angina, so just pain. And before menopause, because of the hormones, they have a higher HDL, which is the good, and lower LDL, which is bad. But after menopause, that LDL starts rising, so that contributes. This is a map of the deaths from heart disease. You can see where Mississippi stands on the map, so we're pretty bad in that. Prevention and modifiable factors, which is what you can do something about. Don't smoke, because nicotine, of course, raises your blood pressure. It's a vasoconstrictor, so it's going to add to any problems. Always control your blood pressure, so if you're taking medicine for high blood pressure, be sure to take it the way you're supposed to take it. Exercise, just regular exercise can make your heart stronger, and it will reduce your risk. Always ask your doctor about taking aspirin. It can prevent some CAD, but it also has risk because it's antiplatelet. Eat healthy, fruits, vegetables, meats, fish, whole grains. Avoid processed foods with a lot of salt, white flour, sugar, and high fructose corn syrup.
Put down the fried chicken.
Put down.
Put it down. Okay. gonna do atherosclerosis is a major cause of CAD. It's characterized by a focal deposit of cholesterol and lipids, usually within the intimal wall of the artery. Plaque formation is the result of complex interactions between the components of the blood and elements forming the vascular wall. As your arteries become blocked, you may have angina, which is chest pain, shortness of breath, upper body pain in the arms, back, neck, jaws, upper stomach, nausea, lightheadedness, cold sweats, heart attack, obviously, fatigue. Diagnosis, cardiac Cad Presentation, cardiac MRI, CTA of the coronaries, electrocardiogram, lipid profile, and stress tests, which we know are so great. Most people who have CAD take medication to help control their condition. Beta blockers, calcium channel blockers, nitrates can all relieve angina. Taking low dose aspirin every day reduces the chance of a second heart attack in people who've already had one. Angioplasty is, y'all don't know anything about angioplasty.
No.
It's a non-surgical treatment for CAD. We use a tiny balloon to push open blocked arteries around the heart. You can put it in the artery, in the arm, or the leg, femoral or the radial artery, obviously. A small metal rod called a stent might be put into the artery where the blockage was to hold the artery open. That kind of looks like the one that was on the absorb stent, doesn't it? Did y'all see that? Coronary artery bypass graft, or cabbage, as we call it. It's a surgical treatment for CAD. Pieces of the veins or arteries are taken from the legs and sewn into the arteries of the heart to bring blood past the blockage and increase blood flow to the heart. Usually done when angioplasty is not possible. There's probably too many blockages, or the arteries are too small. Everyone is different and the prognosis varies between people. Early treatment is key, and MI is a huge risk of uncontrolled CAD, so prognosis depends on the severity of damage and level of heart failure. Ethical issues, socioeconomic issues, lack of resources due to economic and educational disparities. So people who really don't have the economic papers to go to the doctor. Some individuals will not get the needed medical attention prior to an MI due to their resources. Early diagnosis is a key element to prevent major damage of the heart muscle. So we all know that, we've seen that. And damage from MIs cannot be reversed. The impact of CAD depends on the level of CAD present or diagnosed. Most people are unaware of CAD until MI happens. That's why it is the #1 killer of men and women. You know, we have people come in all the time that don't realize that they've had a heart attack. When you tell them, they're surprised. During or after MI is optimal when patients receive intervention, and preventative measures such as heart risk assessments and early treatment are vital to heart muscle preservation.
This is just gonna list some of the top 5 nursing diagnoses as how we, as nurses, can best care for our patients with CAD. One of the nursing diagnoses is acute pain, and it's gonna be related to the ischemic heart tissue damage, or the blockages in the coronary arteries. You know, your objective is the client's gonna be able to demonstrate a decrease in chest pain and pressure and show relaxations. What are some of the things y'all do to help people? Pain medicine. I know somebody said something about, they were talking about Versed and all this other fentanyl and decreasing pain. So, oxygen, monitoring the vital signs, keeping that in check. Instruct them that if they're having any instance of chest pain, to immediately report it for, you know, what's going on. Relaxation techniques, breathing in and out like you would with when you're in labor. It's really good. Activity intolerance related to imbalance differences between oxygen supply and demand, and the presence of necrotic tissue and myocardial ischemia. The objective is the client shows an increase in the ability to perform activities. So if you have somebody that comes in that usually is 7 sedimentary and doesn't do any activities at all, how long do y'all normally tell them to get up and exercise like the first week? Start slow, you're not starting marathons, go slow, work with it. Show the patients the physical signs of overactivity. Because some people can get out of breath, they can show like they're perspiring and everything, so show them that, let them know what's going on. Race for decreased cardiac output related to changes in the rate, rhythm, cardiac conduction, decreased preload, or increased SVR, myocardial infarction. The objective here is there's no decrease in cardiac output during the actions of the nurse. So, what's some of the things that you're gonna try to check?
Assess pulses. Assess heart sounds.
It's
Breast
right there.
sounds.
And listen to your breath sounds. Yeah. You can stay with the patient during any time of activity. Don't let them get up and walk around, especially just after a procedure. Serve food that's easy to digest. And I don't know where that lady is that was talking about having the problem with
Right down
digestion
here.
food earlier, but yeah. Reduce the consumption of caffeine, because that's gonna increase your heart rate. Risk for impaired tissue perfusion related to decreased blood pressure and hypovolemia. During this nursing action, there is not a decline in tissue perfusion, is what your objective is gonna be. So what's some of the things that we're gonna monitor?
Level of consciousness.
Yeah. Yeah. And the normal things, you're gonna, when you walk in the room, you're gonna look, see if they're pale, sign on it. When you reach over to touch them, is their skin cold and clammy? You're gonna look for all that. And another one is risk for excess fluid volume related to decreased organ perfusion, increased sodium retention, and decreased plasma protein. And the objective here is there's an increase of fluid in the body of the client during the treatment. What are some things you're gonna look at when you walk in the room?
JVD.
Yeah.
Edema.
Breath sounds.
Do y'all keep people up here, or do they automatically go to the floor? Okay. So one of the things the nurses on the floor might look at is their weight every day to see how that's flowing, and making sure that they're following a low sodium diet and giving the diuretics as prescribed. These are just some of the resources that we use. Does anybody have any questions about stuff that we went over?